We will lastly review Submodule 3 on dietary supplement ethical considerations in nutrition and dietetics. In this video, we're going to discuss key components of and how to apply the Academy of Nutrition and Dietetics Code of Ethics for the profession, as well as the guidelines and position paper addressing issues surrounding the nutrition assessments, consultation, recommendations, and sale of dietary supplements by registered dietitian nutritionists. So why is it important to consider ethical issues when dietitians are recommending dietary supplements for their patients or clients? We know from the previous videos that dietary supplement use is widespread. Over half of adults and approximately a third of children report use of supplements. There is limited regulation by the FDA according to the 1994 Dietary Supplement Health and Education Act. There are a number of reported consequences of this limited regulation by the FDA as it affects supplement quality. There are health consequences as well as effects to athletes' eligibility status. The Academy has outlined their Code of Ethics, which provides guidance regarding the values and ethical principles adopted by dietetics practitioners, and this actually applies to all RDs and DTRs, which are members of the Academy as well as non-members. It also applies to Academy members who are not credentialed dietitians or DTRs. There are 5 areas that are addressed in the Code of Ethics. We first see the fundamental ethical principles, the responsibilities to the general public, dietitians' responsibilities to their clients, and also responsibilities to the profession. Lastly, it addresses responsibilities to professional colleagues and other health professionals. So under each of the 5 categories, there are statements listed that are relevant to issues surrounding the recommendation of dietary supplements by dietitians to their patients or clients. So I've outlined statements that would fit within each of the 5 sections. So for the first section on fundamental ethical principles, the statement that applies is that the dietetics practitioner accepts the obligation to protect clients, the public, and the profession. So for supplements, to protect clients, they would be obligated to provide recommendations for supplements that are safe and effective. Under the section Ethical Responsibilities to the Public, statements that would apply: the dietetics practitioner considers the health, safety, and welfare of the public at all times, and the dietetics practitioner provides professional services with objectivity and with respect for the unique needs and values of individuals. So this is referring to the need to assess an individual's nutrient status, their individualized needs, when providing recommendations on dietary supplementation and not just giving a general or one-size-fits-all approach. The next section is ethical responsibilities to clients. So the dietetics practitioner provides sufficient information to enable clients and others to make their own informed decisions. So a role of dietitians is education. It's important that dietitians educate clients and patients about dietary supplements, their limited regulation, as well as the evidence-based information as it relates to the current literature on if that supplement product would be effective given their characteristics, goals, and conditions. The next section is on ethical responsibilities to the profession. The dietetics practitioner practices dietetics based on evidence-based principles and current information. So again, it's important for dietitians to stay current with the most recent literature and practicing accordingly and providing dietary supplement recommendations accordingly. The dietetics practitioner presents reliable and substantiated information and interprets controversial information without personal bias, so providing recommendations not based on anecdotal evidence or personal experience. Also, the dietetics practitioner assumes a lifelong responsibility for personal competence in practice continually striving to increase professional knowledge and skills that apply in practice. So this is referring to the need to stay current as it relates to the most recent information about dietary supplements, current literature, and recent policies that affect the regulation of supplements and their subsequent risks. Also, statements relating to the section on responsibilities to the profession. The dietetics practitioner makes full disclosure of any real or perceived conflict of interest, and the dietetics practitioner does not invite, accept, or offer gifts, monetary incentives, or other considerations that affect or reasonably give an appearance of affecting his or her professional judgment. So, for the first statement, for those dietitians that are involved in the production or sale of a dietary supplement product, that activity be disclosed and any conflicts of interest be provided to patients or clients, and also that a dietitian not be influenced by incentives or gifts when providing recommendation. Under the last section, ethical responsibilities to colleagues and other professionals, the statement that applies is that the dietetics practitioner does not engage in dishonest, misleading, or inappropriate business practices that demonstrate a disregard for the rights or interests of others. So there are two publications from the Academy, one that was published in 2002 and the other that was published in 2009, and these both provide information as it relates to ethical guidelines and considerations for dietitians when providing recommendations for dietary supplementation to their patients or clients. So the first is guidelines specific to the recommendation and sale of dietary supplements. And the second is the position paper on nutrition supplementation. So after reviewing both of these publications, I have outlined a list of guidelines, which basically merges recommendations and guidelines from both of these publications. So there are 11 guidelines outlined in the next 4 slides that we'll review. And again, these guidelines are provided from the 2 publications from the Academy. So in the recommendation of dietary supplements, dietitians should consider the following. Their recommendations should be based on individualized needs and only considered after providing a nutrition assessment to evaluate needs and individuals' subsequent nutrition risks. Use of supplements should be considered second to and in conjunction with dietary modifications. Specific supplement recommendations should be based on recent evidence and an accumulation of scientific literature for individuals specific to their age, gender, and ethnicity, among other factors. Recommended supplements should be safe to use with reasonable assurance of limited risk of product toxicity in consideration of individuals' disease state or other condition that may increase risk of adverse events. And recommended supplements should be recorded in the patient or client's medical record. Adverse events should be reported to the FDA and shared with referring health professionals, such as the referring physician. Dietitians that consult patients or clients on the use of supplements should participate in continuing education to maintain a current understanding of supplement risks, safeguards, and policies affecting the regulation or safety of dietary supplement use. Dietitians that engage in the sale or manufacturing of supplements should clearly disclose financial relationships and conflicts of interest and avoid personal bias when providing recommendations. The recommendation of supplements should be paired with client or patient-specific and evidence-based educational materials, including information about the supplement, its use, and potential risks. And lastly, dietitians recommending supplements should address the following factors when applicable, which may affect the safety and efficacy of a product for a specific individual, including their total nutrient intakes, laboratory values, genetics, genomics, contraindications, nutrient excesses, drug or nutrient interactions, and supplement forms and doses. So therefore, these guidelines intend to limit an individual's risk and optimize their safety and health. They have a food first, individual specific focus. It's important to provide financial disclosures or conflicts of interest. It's important to stay informed with continual education, to provide adequate education to patients or clients, and to report adverse events. So this concludes the last video of this learning module. I hope that you enjoyed the information that you learned as well as the application activities. Please continue to the last application activity, which asks you to review 3 case studies and to choose 2 to explore and discuss in more detail by responding to the prompt.